Lieutenant Governor of Guam.
Good afternoon. Good afternoon.
Day, everyone, and welcome to today's proclamation signing ceremony for October 2024 as Substance Use Prevention Month. Before we begin with the remarks, of course, I want to recognize the presence of the Honorable Leon Guerrero, Lourdes Leon Guerrero, Governor of Guam. Let's give a round of applause. As well as the Honorable Joshua Tenora, Lieutenant Governor of Guam. From the Leon Guerrero Tenora administration, we have the Guam Behavioral Health and Wellness Center, our JIPWIC Director, Carissa Pangilinan. As well as our Deputy, Dr. James Cooper Nurse. Let's keep those applause coming. We also have Melanie Brennan, Director for the Department of Youth Affairs. And her Deputy for DYA, Michael Weekly. And also Ina Carrillo, General Manager for PBS Guam. I know we have a lot of partners in the house, so I'm going to do my best to acknowledge all of you. From the Peace Council, let's give them a round of applause. The One Kill Can Kill Task Force and our partners, please. Round of applause. The State Epidemiological Outcomes Work Group, that's SEOW, Hoffaday. Thank you so much for joining us. Our Substance Use Prevention, Treatment, and Recovery Coalition, Hoffaday, thank you for joining us. The Guam Army National Guard, West Care Pacific Islands, and those of you watching virtually on Governor's YouTube channel, Cesar Smasi, for joining us. Without further ado, and to get this program started, I want to give the microphone to my friend, Guam Behavioral Health and Wellness Center Director, Carissa.
Thanks, Crystal. Okay, let's get started. Governor and Lieutenant Governor, thank you so much for always showing your support for us and all the work we do at Guam Behavioral Health and Wellness Center. I did want to give a warm welcome and say good afternoon to all of you. I know some of you were here just a few weeks ago when we were proclaiming Suicide Prevention Month and Treatment and Recovery Month. So as we kind of close out on that, we're moving into what is now the first, so we'll call it the inaugural proclamation of Substance Use Prevention Month. And so some of the partners that are here that we didn't mention earlier is GDOE and PBS is already here, so a bunch of the other agencies, you'll see the logos on the bottom of this, which we'll go over later, but we are the task force. And so just some history, the governor called James and I in to a meeting a couple months ago and basically told us, you're going to start a campaign because we care about the kids. That's really in short. So figure it out. And we did with her support and with the support of her office. So thank you, Crystal and team as well. You'll see Sarah, our prevention manager, also unveil everything, and then the governor and the lieutenant governor as well. So I just really wanted to welcome you all and let you know that some of the data that we have that we know is the longer you prolong the use of substances, the likely you are to decrease addiction. Okay, so let that sit in. It means that our prevention needs to start in the schools. So thank you. We invite you to participate in all our October activities, which Sarah will go over next. We're doing something a little different today. There's going to be an unveiling of the campaign and then the proclamation. So come on up, or you're going to stay there.
I need to hear with my Thank you, Director.
Sarah, before you begin, I do again want to acknowledge Guam Police Department. Let's give them a round of applause. The Department of Education and Dane, I see you from Onalu. Please raise your hand. Show us where you're at. And a little great partner for us here at the Office of the Governor. Thank you. And now I want to give the floor to Sarah Howell from Guam Behavioral Health and Wellness Center.
Thank you, Crystal. Thank you, Director. Before we talk about the different activities that are happening this month, there will be a lot, and that's why there's a huge full room of people here, because it's really about partnership. Prevention, it's not really an 8 to 5, Monday to Friday job. And no, that doesn't mean that we work 24/7. We're not we're not going overtime or anything. It just means that each one of us in this room, everybody in our community has a stake in prevention, that we all have a role to play at varying levels, varying capacities, but we all are stakeholders and champions for prevention. What that means is I am the prevention manager at Gone Before Health, but when I get home, I'm also a mom. And I talk to my husband. Well, I can't really talk to my 4-year-old yet, but I mean, I do talk to him, but I bring my prevention messages, what I learned at work, during dinner, or having conversations with my family. We can also bring prevention at weekend hangouts with our friends, or we can bring it at Saturday mornings with our rugby or soccer or football mom and dad friends, because it all has to happen in every nooks and crannies and areas and venues in our island community. Everybody here has a stake and a role to play in prevention, because it's not just something that can happen in the government level. So prevention happens all year long, but in this month, the next 4 weeks, we will be highlighting some activities that will allow you to recognize what skills you can learn, what information you can better equip yourself with, so that you're not just better informed, but you're more confidently skilled to bring the power of prevention into whatever spaces you can bring yourself. So that's what the theme for this month is: empowerment through prevention. There's a lot of us in red. I do have my red ribbon here. One of the things that we will do this month is partner with the Red Ribbon Committee. October is also recognized as the Red Ribbon Month. Sorry, before I go to Red Ribbon, we are also partnering with DEA on the National Take Back, or RX, Prescription Medication Take Back initiative. So October 26th, we will be at Agana Shopping Center. We will be at Premier Outlets. If you have access to NEX or Anderson Air Force Base, there will be some drop-off areas there, as well as a Dedito Senior Center. What happens here is that a lot of us, I myself would be guilty of this. I have expired medication that's just sitting in the counter at my house. My 4-year-old can't access that yet, but if maybe I have a teenager, if I have some unknowing members of my family, that could cause some accidental or maybe intentional misuse of prescription medication. So we encourage our community members, if you have unused, expired, or pills that need to be discarded, do not flush them in the toilet. That's a whole different proclamation signing to talk about. But please gather them and bring them to one of these drop-off locations on October 26th, and let us help you, through the help of DEA, discard your prescription medication properly. And then also talk to us about what other information we can share with you about prevention and substance use. The second one is about going back into Red Ribbon Month. October is also, and has always been, I think, ever since I can remember, October is Red Ribbon Month. So what that means is our schools will be saturated with about the story of Kiki Lamarana, right? We'll be hearing about amazing information, resources, some skills that are targeted towards middle schools, elementary, and high schools. If you have family members who will be hearing about this in the schools, please talk to them. If you're a parent and you know, or even if you're a bus driver or one of the school aides, talk to the kids about what they're learning in these workshops that the Red Ribbon Committee had shared to them. I think the more that we instill these resources, these skills to our youth, the more that it becomes not just information that's in and out, but habits and lifestyles that they will bring on to their teenage and adult years. Another one that we'll be doing is our Vape Take Back program, and that's in partnership with Department of Education. We heard about the vape epidemic even before the global pandemic happened, and it's still ongoing. It's actually getting worse. And so starting this month, actually it's been happening, we are partnering closely with the Guam Department of Education to see what else can we do, maybe something more, something differently, because clearly it's not quite effective enough, right? There is still an issue about vape use among our youth, especially middle and high school. But our call to action is, youth and kids, they're very impressionable. They look up to their adults. They look up to their sisters and their siblings. Sometimes they even do what they are doing, right? They're reflecting and following the habits and lifestyles of the people that are surrounding them, that have had influence on them. Our call out to our adults in the room and in our community: we understand that vaping is a legal substance, but be mindful, be demure, be cute. You're just kidding. Be very mindful of who is around you, who's listening to you, and whose actions you're influencing. Quitting vaping is not easy, as we know about tobacco and nicotine use, but also know that resources are available. That's another prevention initiative. When you are ready to quit smoking, vaping, or chewing tobacco with your with your beetle net. There are cessation services available at Guam Beaver Health and Wellness Center in person that we can offer to you free of charge. Now, if you feel a little embarrassed or shy, or you just don't have during the time of day to be able to go to our department to do that, through our partnership with Department of Public Health and Social Services, there is a free service, confidential and absolutely free, just called 1-800-QUIT-NOW to use or to talk to somebody to our cessation service through phone. There will be a lot of things happening this month, so if you could kindly, if you don't follow us yet on our social media platforms, it's at GBHWC Guam on Facebook, Instagram, and YouTube. Prevention is also talking about not just hearing the information and keeping it, it's also about sharing it to people that we know of. So you have such powerful influence on your networks and your communities. So when you see these stories that we've been posting online, we encourage you to not just watch and like, but also share and talk about it with people around you, people that you love and care about, because it's an important message that we should be spreading widely. Most recently, and this is where I kind of segue into my partner here with Audrey, in the past recent years, we've been following the trend of prescription medication misuse. And although it's at a low rate compared to alcohol or tobacco or even marijuana, it is increasing at a rapid rate. And so we want to be proactive. And two of the activities that we are launching today for October as Substance Use Prevention Month is to combat the increasing concern on fentanyl and opioid misuse. So Audrey can take it away.
Thank you, Sarah. So the One Pill Can Kill campaign is an awareness campaign that was developed by the Drug Enforcement Administration that we've been able to adopt locally to provide information about the dangers of counterfeit prescription drugs and fake medications that are containing fentanyl. And I really want to thank the other agencies who are part of we call ourselves the One Pill Can Kill Task Force. Sounds so great, right? So that includes DYA, PBS, DOE, the Guam Army National Guard Counter Drug Program, Guam Youth Congress, and then of course the Office of the Governor for really your joint effort in launching this campaign and getting this out, especially to our youth who really provided valuable feedback for the campaign and really I think humbled us when we tried to put out our gray posters, right? And they were like, no, that's not going to work in the schools or in the youth. So that's just so important of bringing the youth on board, especially because we're trying to implement this in the schools. So by launching this in the middle and high schools on island and then in the community, we really hope to educate individuals and especially our young people and our parents to not take medication that's not prescribed to you or that isn't prescribed by a licensed medical professional, but also encourage conversations by the parents to have them with these kids. I have a 3-year-old son at home and he saw one of the posters in my purse last night and he pulled it out and he goes, "Mom, is this candy or is this medication?" And how powerful is that, right? That he's only 3, but I can still have those conversations because he's very aware of what it looks like to him. So in line with this, for the middle and high school schools, they will be receiving a One Pill Can Kill packet that has flyers, banners, posters, resources that can be shared to their campus community. So we really are hoping that the schools put them out and display them for their students to see. Additionally, PBS has adapted PSAs to be shown throughout the various media channels and media outlets that include messages from the governor and lieutenant governor that highlights the overall campaign. And then lastly, we're holding virtual trainings every Friday for the month of October on opioid overdose response training to provide education on how to raise awareness of how to recognize the signs of an opioid overdose, and then how to respond with it using naloxone. And we want to thank the governor for her support in providing admin leave to GovGuam employees so that they can take the time to take the training. And we really encourage other agencies and organizations to hop on our training as well. It will be open to the community via Zoom. And this is really a life-saving training. And naloxone is also a life-saving medication that we want the community to be able to be better prepared to respond to and with. So just encourage everyone to share on social media. We'll be launching everything today, but also on our social medias throughout the day. And then really have the conversations at home and really normalize the topic, and providing a safe and encouraging environment in our home, in our schools, in our workplace, so that the community and our kids, of course, can be better informed. Thank you.
Mason, now we queue up the PSAs for your viewing. This is a premiere of the PSAs for the One Pill Can Kill campaign.
One pill can kill. Fake pills often contain fentanyl. It only takes 2 milligrams of fentanyl, equivalent to a few grains of salt, to be lethal. Fake pills are often sold on social media platforms, making them available to anyone with a smartphone.
Taught early and often to youth about the dangers of misusing prescription drugs and the lethal dangers of counterfeit drugs laced with fentanyl.
Stay informed, stay safe. One pill can kill.
So you're going to see more of those PSAs in the media, in the local media, as well as our partners who will be sharing that material. And again, also, especially want to thank the Guam Department of Education for taking these packets and for sharing this with our students and our parents. Now I want to give the floor now to our governor, Lilian Guerrero, for her remarks.
Thank you very much, Crystal. Wow. You know, as I was listening to Audrey and Sarah, and looking around to see all the community support on this campaign of substance misuse disorder, and also many special focus in your various partnership. I can't help but feel like we are very fortunate as a community to have all these great people working together to fight this very terrible epidemic. You know, the statistics that we're following is very alarming in the areas of alcohol abuse, tobacco abuse, vaping abuse, where we are now seeing vaping in middle school. How sad is that for our community? Very, very sad, and very alarming. We're starting to see many of these pills coming through the mail. And we are very fortunate to have a very aggressive investigation and very aggressive team through the mail. The Customs and Quarantine Director tells me that so far they have confiscated about 275 pills that are suspect of fentanyl, and that they are now analyzing it to verify the suspicion that it is fentanyl. And I am really very much pleading with our community, especially those who are addicted, to think about this, because we're seeing more methamphetamine laced with fentanyl, and science experience will show you that fentanyl can kill, and it does kill. Why are we so concerned about it is because of the severity of its effects. It is 10 times more addictive or more serious than morphine. And we are so concerned about it to the point that we are giving out free naloxone through mental health, through behavioral health. Every police officer and law enforcement officer that responds have, it's called also Narcan, I know it more as Narcan, in their possession to help. And I have heard stories and been given reports that it has saved some lives of our individuals that are addicted to methamphetamine, who have taken methamphetamine laced with fentanyl. And of course, fentanyl also comes as a fake pill also. And I think is very close to Zola. Is it Zola? For one of the anxiety pills that people do take, and that they suffer, their demise from it. And so I think it's Xanax, sorry. But it's very scary out there, and people do this to make a profit and to make money. And they are making money out of the demise of our family, our children, our loved ones. I'm sure a lot of you know of people who have, unfortunately, are addicted, and all of you out there that work to prevent it, to treat it, to help rehabilitate our people are just, I think, jewels of the community. And it just shows you as a community how very serious we are as professionals, as parents, as teachers, as religious leaders, about the importance of working together to get this under control. It is just way out of control. And we are doing everything within our humanly possible means to get it under control and to fight this epidemic. And it's not just us, but throughout the nation of the United States. And I am also seeing it more in our Pacific Island brothers and sisters. I just came back from Pacific Island Forum. That was one of their concerns, is the increased use of drug addiction and alcohol in all of our neighboring islands and brothers and sisters. So it's not only locally, it's regionally, and it's nationally. I would say even global. Worst off, I think, than the pandemic. And so I encourage people to please teach their children the effects of drugs. Teach our neighbors, like you said, Audrey and Sarah, it's a 24-hour job. It's a 24-hour commitment. It's a 24-hour passion that we continuously work hard to prevent the use and treat it and rehabilitate it with programs, because I am sure many people who are suffering addiction are also wanting to get off. And us as a community, all of us as professionals in our programs that we have are there to help and support you. So please make sure you come to behavioral health for help, or even someone that you trust and love, whether it's your priest or your teacher or your parent or, your good friend. Please allow us to help you, because we do want to help you, and we want all of us to return to being good, productive residents and citizens of our island. So thank you, all of you, for all the hard work that you do, and know that your hard work is very much recognized, acknowledged, and we are starting to see some good results of it, but it is a long, hard, slow struggle. And thank you for your patience and your commitment, your dedication, and your diligence in improving the lives of our people here. Sidus Masi.
Thank you so much, Governor. I now want to give the floor to the Honorable Joshua Tenor, Lieutenant Governor Guam.
Thank you. I just wanted to briefly add that, the effort, and I just want to recognize DOE and the other schools that are present and that are going to be active. You get the highest yield from working with the youngest of the children, right? We saw that with Click It or Ticket, We see that with so many effective campaigns. But here, when you speak to teachers and to principals, many times we're hearing, not only in middle school, but in the elementary schools are showing up with vapes, for example. And one of the big things that Carissa shared earlier was, I think, something we can all remember. The longer it takes, or the longer a period of time that a person is drug free, means the less time that they'll be susceptible to substance abuse, which is very prevalent in our island for decades now. It is a big undertaking, and as we've talked about, the addiction to meth is more than 30 years on the island. But part of it is empowering and recognizing schools, nonprofit organizations, and communities to provide alternatives for our youth, especially. And so programs like the Guam National Guard and the work they do with the Juvenile Drug Court and throughout the school system, not only in prevention, but also nurturing and helping recover some of the juveniles that are on the bad track. Those are all part of the community response. In these last few years, the governor and I have been expanding the number of opportunities for nonprofit organizations to get funding to launch and sustain after school programs, summer programs, Christmas break programs. And I just invite the community to continue to get involved and do what you can. We also have a campaign to expand recreational facilities throughout the island. The last couple of days, we just opened new gymnasiums in Dedido and in Mauricio. Soon we'll be opening in Maguilao and Barrigada, but every single village in our vision is going to have access to safe facilities that the kids can excel in whatever activity it is, either in sports and recreation or team building, or just a place that they can go to with their cousins and to enjoy being a kid, right? Which is, I think, many of the children that we see in the system, unfortunately, with high rates of kids in the child welfare system, unfortunately, the innocence has been lost on some of them. But that doesn't mean we give up on them, right? Together as a community, we can do things to rescue them and to give them all the opportunities that we want them so they can expand what they need to do and to be able to thrive on this island. So to the community of organizations and individuals that are involved in substance abuse prevention, we do have a lot of work ahead of us. But I'm encouraged, like the governor, that we have a good organized effort. And I think that I'm very optimistic that we'll be able to make a big, big difference out there with all of your help. Thank you very much. And Viva Substance Abuse Prevention Month.
Thank you, LT. And it won't be long before we see each other again, because at the end of the month, we have Red Ribbon Week. Okay, so this is not the first. This is just kicking off the events. Without further ado, I want to give the microphone now to Haley Ann Pangilinan from the Peace Council. She's also representing the Guam Youth Congress and also part of our One Pill Can Kill campaign task force. One of the trusted youth voices that told us, no, that campaign's not going to work. No, that banner's not going to work. This is what the young people want to see. So thank you again to Haley. She's one of those voices.
Thank you so much. So I'll go ahead and introduce the proclamation. Proclamation number 2024-87, a proclamation of the Governor proclaiming October 2024 as Substance Use Prevention Month. Whereas substance use is closely related to mental health, a key component of a person's overall health and well-being. Therefore, addressing the complex mental health needs of children, youth, adults, and families today is fundamental to the future of our island. And whereas 1 in 5 adults on Guam partook in binge drinking in 2023, according to the Centers for Disease Control and Prevention. And whereas Guam's smoking prevalence is the highest in the country, with 1 in 5 adults being current smokers, and e-cigarette use or vaping among Guam youth is the highest in the nation and in the West Pacific region, with 1 in 3 middle and high school students reporting current use, according to the Guam State Epidemiological Outcomes Work Group. And whereas about 15.5% of high school students on Guam reported taking prescription pain medication without a doctor's prescription, an increase from the reported 10.9% in 2017. And whereas more than 80 million fentanyl-laced pills and nearly 12,000 pounds of fentanyl powder were seized by the U.S. Drug Enforcement Administration. And whereas Guam Customs and Quarantine reported 117 seizures, confiscating 119 tablets suspected to contain illegal fentanyl, and whereas, according to the Guam State Epidemiological Outcomes Work Group, various data indicate that in prescription or counterfeit form, opioid use and misuse is an emerging concern on Guam. Based on death reports from the Chief Medical Examiner, seizures from the Guam Customs and Quarantine Agency, and self-reports on the low perception of harm among our youth and adult population, there is sufficient evidence to warrant heightened vigilance against opioid use and increased community outreach and education to inform the public about the potential harms from these substances. And whereas substance use disorders stem from underlying mental health issues and are common and treatable, and about 1/3 of adults have reported one or more mental health symptoms in the last 30 days. And whereas, as of today, 48 individuals have been treated for opioid use disorder at Guam Behavioral Health and Wellness Center's Level 3.7 Withdrawal Management Unit, also known as the Detox Unit, since it opened in 2021. And whereas the stigma surrounding substance misuse and substance use dependence is a significant barrier inhibiting people from seeking care, and whereas each business, school, government agency, healthcare provider, organization, and citizen has a responsibility to promote substance use prevention and support prevention efforts. And whereas all citizens across the island are encouraged to recommit our community to increasing awareness and understanding of substance use and misuse prevention, mental health, and the necessity for appropriate and accessible services for all people with behavioral health conditions, and whereas Guam Behavioral Health and Wellness Center partners with nonprofit organizations, community and faith-based programs, support groups, advocates, private practice doctors, and other professionals on Guam, all working to combat the stigma of substance use, provide necessary mentorship services and support, and strengthen the mental health and well-being of children and adults in our island community. And meanwhile, October is nationally recognized as Substance Use Prevention Month, and citizens are encouraged to tell their prevention stories. On Guam, Guam Behavioral Health and Wellness Center leads these efforts with the theme Empowerment Through Prevention. Whereas as part of the Substance Use Prevention Month, the Office of the Governor, Guam Behavioral Health and Wellness Center, Department of Youth Affairs, PBS Guam, the Guam Youth Congress, the Guam Army National Guard, and other partner organizations are working to roll out the Drug Enforcement Administration's One Pill Can Kill campaign in all Guam Department of Education schools to spread awareness of the dangers of fake pills.
Now, therefore, I, Lourdes De Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim October 2024 as Substance Use Prevention Month.
In witness whereof, I, Joshua F. Tenorio Segundo Magatla Guahan, Lieutenant Governor of Guam, hereby, together with the Magahaga, cause a great seal of Guam to be affixed here in the capital city of Hagåtña on this 4th day of October in the year of our Lord, Anno Domini 2024. Viva Guam! Viva!
Thank you so much, Haley, and thank you so much to our governor and lieutenant governor for the signing of the proclamation. Again, we're going to see each other very soon at the end of the month for Red Ribbon Week. But now this time, I want to call everyone up to the front for a group photo. Yes, I'm going to call you to the front because all our collateral is up here. So please, let's take a group photo and memorialize today's event. Just Mossy to all our viewers online.